Right. Welcome, Jackie. Thank you for joining us today to talk to us about your cancer journey. I'm going to ask you a few questions in a minute, but I understand that during your experience at Yeovil Hospital, we impressed you so much, you actually joined the team and became a ward clerk. Is that right?
That's right. So I joined the ward clerk team about 3 years ago and have enjoyed every minute.
Brilliant. Well, thank you. So, Jackie, can you just tell us a little bit about your cancer journey?
Certainly. So I was diagnosed with bowel cancer, stage 3 bowel cancer on the 25th of April 2016. That was a life-changing day for me. I went through so many emotions, the shock, the horror, the disbelief. However, my journey began that day. I had some chemotherapy and a course of radiotherapy at Taunton. I then had further chemotherapy to make sure that the tumour had shrunk sufficiently for me to have surgery. My surgery was in November 2016 when I had a tumour removed and I had a stoma fitted. That was a life-changing moment as well. However, I had a lot of support from the stoma team whilst I was in hospital, and I was shown how to live with a stoma. So on leaving hospital, went home relaxed and had a stoma for about 10 months. After which I had my stoma reversed. And again, that was a bit traumatic, hoping that I would be back to normal. And fortunately for me, I feel quite blessed the fact that I was, or I am as normal as, yeah, I am back to normal now.
Brilliant. Now, Jackie, I understand that you called your stoma a certain name in order to help you cope with it better. Can you just tell us, make us chuckle and tell us that?
This is true. So before I was due to have my surgery, I went on holiday to America to see my family. And whilst I was there, I was there at the same time as the presidential elections. And I understood that people named their stoma, gave their stoma a name. So I decided to call my stoma Trump.
Brilliant. I think it does help sometimes, doesn't it, to call it a name and just make light of it sometimes.
It is, Julie. Yeah, that's true. And I think there's a stigma attached to stomas, because obviously when people have a stoma, they're worried about leaking and about it smelling. But a nurse said to me that if you look up like Yeovil High Street and look at the people there, you won't be able to tell who has a stoma and who hasn't. And that was really good advice to me, because it kind of removed a little bit of fear and anxiety that I had. I found the experience quite rewarding and pleasant.
Sounds to me like you've got a very positive attitude, Jackie. Have you got any tips for people watching this video that might help them cope with their cancer journey?
Yes, I called it a journey rather. Some people call it a fight. I called it a journey because my bowel cancer journey would take me on different roads and in different directions. And ultimately, I would reach the end of my journey and see light at the end of the tunnel. The advice that I would give to cancer patients is just to take each day and to reward yourself and believe that how well you've done on your journey, and also to share any anxieties and any emotions with your family and your friends, because it does help talking to people. I found that talking about it made it easier for me to come to terms with my bowel cancer, and also bowel cancer isn't necessarily life-threatening. If it's treated early, then that's a better sort of end result. And so it's important for people to be aware of the symptoms and to contact their doctor as soon as possible if they're unsure. Because again, it's a taboo subject. When we go to the toilet, we don't necessarily, we should be checking on things, but we don't, and we sometimes brush them under the carpet. My actual original diagnosis came as a result that I just noticed some blood when I went to the toilet, and I kind of brushed that aside as something else. Had I gone to my doctor straight away, then I might have just been diagnosed with stage 2 bowel cancer, but I had stage 3, which means that it had gone into my lymph nodes, is that right?
Yeah.
Lymph nodes, and into the bowel.
Brilliant. Okay. And did you find it impacted you a lot emotionally?
Emotionally, it kind of comes and goes, and it sometimes when you're not expecting it, you'll kind of think, or you'll be reminded. For me, the fear of my cancer coming back is with me all the time, but most of the time it's at the back of my head, so I don't kind of think about it. But certain anniversaries and things like that can trigger off some emotions, which again, it shouldn't be an embarrassment. People have to release their emotions, and if you feel like just having a good old cry, then that's fine. Nobody's gonna say anything. You know, that's not anything bad to do. If anything, it's a good thing to release your emotions.
Thank you very much, Jackie.